Prior to practicing suctioning on a co-student, the correct OSHA-approved 2-wipe disinfection method must be performed on the dental unit. If you are not sure of the correct method of disinfection of a dental unit, please review the opening wipe and barrier video. You do not need to disinfect the utility cart or any of its attachments. With clean hands, no gloves required, place the disposable barriers. Those needed for this procedure are the patient chair, the light handle on the dental assistant side of the chair only, the light switch, the HVE, the LVE suction devices, the air water syringe, and the patient chair control touchpad on the dental assistant side only. Next, wash your hands or use alcohol rub to clean your hands. Don gloves. Place air water tips into the syringes and suction tips onto the suction hose connectors. The HVE tip should be placed into the hose connector with the bevel of the tip open and facing up and in line with the suction device finger switch. The hole or slot on the HVE should be up to go into the patient's mouth. After seating your patient, provide them with protective eyewear and place their protective bib on. Now place the patient into a supine position and arrange your dental assisting chair in the correct position for the suctioning procedure. The assistant must again use alcohol rub and dome PPEs. They should be put on in the correct order, which is the gown first, then safety glasses, and mask. Use alcohol rub again, then don new gloves. The assistant can now be seated and pick up the HVE suction device in the right hand, holding it in a pen grasp or a thumb to nose grasp, and turn the switch to the on position with the right index finger. The air water syringe should be picked up and held in the left hand. With the suction device turned on, a 20-second flush of water from the syringe should be directed into the HVE suction tip. In addition, the assistant should practice an air water spray into the HVE suction tip. Turn light on and direct the light into the patient's mouth. To rinse a bad taste from the patient's mouth, the assistant should use the LVE suctioning device. Held in the right hand, the assistant places the LVE tip into the patient's mouth and activates an air water spray to rinse back and forth across the patient's tongue. Be careful not to place the LVE tip in the center of the tongue, as this may cause discomfort to the patient and may possibly cause them to gag. Lift the LVE and move it back and forth from one side of the mouth to the other to collect the water and saliva that will pool in these areas. Instruct the patient to keep their mouth open while you are performing this procedure. Next, the assistant will use the HVE tip to suction water from the patient's mouth in the posterior area. Holding the HVE suction device in the right hand using a pen grasp, make sure the bevel and switch are facing up so the switch can be turned on and off using the right index finger. When using this device, the bevel should always be held parallel to the tooth or teeth you are rinsing in all 4 quadrants. When suctioning the patient's left side, the bevel will always be parallel to the facial surface of the teeth. When suctioning the patient's right side, the bevel will always be parallel to the lingual side of the teeth. After a few seconds of rinsing, discontinue spraying the water and collect what has pooled in the corners of the patient's mouth. Again, avoid touching the middle or back areas of the patient's tongue. Use the air-water syringe tip to retract the cheeks, which will create a clear vision of the area and eliminate the tendencies to suction the soft tissues of the cheeks, lip, and tongue. Also be careful to avoid resting the suction tip on the patient's gum tissue or lips during a procedure. Be aware of where your suction tip is located at all times, as this can cause the patient great discomfort. When the dentist is preparing the tooth from the lingual aspect of the anterior area, position the HVE tip so that it is parallel to the facial surface and extends slightly beyond the incisal edge. When the dentist is preparing the tooth from the facial aspect of the anterior area, position the HVE tip so that it is parallel to the lingual surface and extends slightly beyond the incisal edge. Limited area rinsing is performed frequently throughout a procedure as debris accumulates during the preparation and restoration of a tooth. This rinsing must be accomplished quickly and efficiently, causing no delay in the procedure. This occurs mostly when the dentist exits the mouth and pauses for inspection. Suctioning is an important dental assisting skill that takes a lot of practice. Do not be discouraged if this procedure seems difficult and frustrating at first. With practice, you will become proficient in this skill.